I'm Linda, I'm a nurse practitioner student. I'm going to be doing a head to toe assessment on you today. And during the head to toe assessment, I'm going to look at your skin and inspect your skin for temperature, color, moisture, texture, nevi, bruising, lesions, scars. I'm going to start with your face. Can you look straight ahead at me? Her face is symmetrical. I'm going to palpate your head for any masses, any depression, none felt. I'm going to look at your head for any infestations. Her hair is thick, full. I'm going to palpate your temporal arteries bilateral. I'm going to palpate your frontal sinus, any tenderness and discomfort. I'm going to palpate your maxillary sinus, any pain or discomfort. Okay? Now, I'm going to check your lymph nodes for any indiscretions or tenderness, okay? Preauricular, any pain. Postauricular, occipital, tonsillar, submandible, submental, anterior cervical, posterior cervical, supraclavicular, any pain and discomfort in either one of them. Okay? Now, we're going to check cranial nerve number 5. I need you to close your eyes for me. Feel anything on your cheek?
Mm-hmm.
Is it soft?
So,
Okay. Now, keep your eyes closed. Don't let me open your mouth. Okay. I checked her master muscle cranial nerve number 5. Now we're going to check you for TMJ. Open and close your mouth for me. Any pain, any discomfort? Okay. TMJ. Now we're going to check cranial nerve number 7. Can you smile? Pucker your lip. Put air in your jaw. Raise your brows. Frown. Okay, good. Now we're going to go on down to your eyes. Her eyebrows are arched with no infestations noted, no pupillary fistulas noted. Her lashes are full. Her sclera is white. Her conjunctiva is pink bilateral. Now we're going to check you for cranial nerve number 2, which I'm going to take you out here and check your vision. Can you come with me? I need you to stand right here. Cover one of your eyes at a time. I'm going to need you to read me the lowest line that you can read. Let me know when to start.
Mm-hmm.
L,
Let's try this one.
D, E, F, P, O, T, E, C.
2020 the left eye, change to your right. Read me the lowest you can read.
L, E, F, G, B,
Try this one.
D, E, F, P, O, T, E, C.
Okay, 2020, you can come back and have a seat on the table for me. Okay. Now, I'm going to be shining a light in your eye. I'm going to be checking her for direct light pupillary reaction responses. Pupil constrict. Pupil constrict. Now, look at me with this eye. Okay? Pupil constrict. Pupil constrict. That's consensual pupillary reaction. Now, we're going to do what's called convergence and accommodation. I'm going to let you look away. Okay? Then you follow my finger to your nose. Okay, good. Okay? Now, just let me look in your eye. Checking for red light reflex. I see the red light. Check for red light reflex. I see the red light. Okay? Now, we're going to do your ears. I'm going to palpate her ears. Her trachea and pinna are intact. I'm going to look in her ear with the otoscope. The right ear canal has no drainage, and the tympanic membrane is pearly gray and at the 5 o'clock hour. Going to look in the left ear. The canal is not red or have any drainage, and the tympanic membrane is at the 7 o'clock hour, and the cone light is at the 7 o'clock hour, and the tympanic membrane is shiny and pearly. Okay. Now, we're going to check cranial nerve number 8. I need you to occlude one of your ears for me. Cover it up. I'm going to say something. I want you to repeat if you hear it.
1, 2, 3, 4.
Good. Do the other ear for me.
8, 7, 4.
Good. Okay. Now, we're gonna do the Riney and Weber test. I'm gonna put this instrument in the top of your head. When you feel it stop moving, raise your hand, okay? Okay, good. Okay, now we're gonna do the same thing, but I'm just gonna be putting it on your mastoid bone behind each ear, checking for air conduction, okay? Let me know when to stop. Okay, good. All right. Now, gonna be inspecting your nose. It's symmetrical. Can I get you to occlude one of your nostrils? Keep your mouth closed and breathe in. Okay, breathe out. Okay, do the other one for me. No occlusion noted. Now, I'm gonna be looking at your lips. Her lips are moist. Can I get you to open your mouth for me? Okay. Her tonsils are grade number 1, and they're moist and pink. Buccal mucosa is moist and pink. Her tongue is moist and pink. I see no caries in her teeth. I can say ah for me. Say ah. Okay. Her uvula, it does come with from that when she say ah, her uvula does come down. Okay, gag reflexes in check. Cranial nerve number 9 and 10 done. Let me get you to move your tongue side to side for me. Up and down. Cranial nerve number 12 is intact. Okay, let me look at your neck. I'm gonna palpate your trachea. The trachea is midline. I'm gonna palpate your thyroid. Can I get you to swallow? Okay, any problem? I'm gonna palpate your carotid artery one at a time. Okay. I'm gonna auscultate your carotid artery one at a time, listening for any bruits. Take a deep breath in, hold it, let it out. Deep breath in, hold it, let it out. Okay, good. Now, we're gonna do range of motion of your neck. Flex your neck, hold it down. Straight ahead. Do your ear to put this ear, okay. Hyperextend. Okay, rotate your neck. Very good. Now, we're gonna go on down to your, I'm gonna push against your shoulder. I don't want you to let me push your shoulder down. Cranial nerve number 11 is in check. Now we're gonna look at her thoracic area, her chest area. I'm gonna inspect the front and back posterior, and it is symmetrical. No respiratory distress noted. Not using any axillary muscles to do it. I'm gonna palpate her back, starting above, right below the scapula. Take a deep breath in for me. Out, in, 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 out. Now I'm going to percuss over the intercostal spaces. Any problem and discomfort? Good. Now, I'm going to put the palm of my hand on your back. I'm going to need you to say 99, 99, 99, 99, 99. We check for a tactile traumitis. Now we're going to do egophony. I need you to say E. 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 Okay, good. Now I'm going to need you to say 99. Let me get you to say 99 low. This is what's pectoral. All the sounds will muffle, which are normal. Now I'm going to go to our anterior chest. Okay. Just let me listen. Excuse me. Now, the aortic is located at the second intercostal space on the right side. Second intercostal space on the left side is pulmonic. Third intercostal, Erb's point is third intercostal space to the left side. Tricuspid is located at the fourth intercostal space. The mitral and the PMI is located at the fifth intercostal space. I'll be listening to a heart rate for 1 minute. Okay, good. Let me get you to lay back for me. Let me get you to turn your neck in that direction. No JVD noted. No JVD noted. Now we're going down to her abdomen. I'm going to listen to her aortic or aorta, which is located in her epigastric area. I'm going to listen to her renal arteries, which are out to the side of the aorta. Then I'm going to go on down to her pelvic area, listen to her iliac. I'm going to go on down to her groin area and listen to her femoral arteries bilateral, and they are present without a bruit. Okay. Then we're going to come back up to her abdomen. I'm going to auscultate her abdomen, starting at the right lower quadrant. Bowel sounds are present. Bowel sounds are present. Bowel sounds are present. Bowel sounds are present. Now I'm going to percuss your abdomen. Now I'm going to palpate. Let me know if you have any pain. Any pain or any discomfort. Okay? Now, I'm going to palpate her liver, and I don't feel it. I'm going to come around to the other side and palpate her spleen. I don't feel it, and I shouldn't. Let me get you to sit up for me, please. Okay? Now, I'm going to hit you over your kidney to check for any tenderness. Let me know if you're tender. What about there? Good. Okay. Now, I'm going to inspect and palpate her upper extremity joints, her fingers, no nodule, her wrist, any pain or discomfort, her elbow, any pain or discomfort, and her shoulders. I'm going to check for a capillary refill. I'm going to check on radial pulse. I'm going to have her squeeze my hand for strength and don't let me pull my hand out. Good. Now, let me get you to prop your arms up like that. Don't let me pull your arms down. Don't let me pull your, good there. Okay. Now, we're going to do range of motion of your shoulder. Flex, extend, hyperextend, abduct, abduct, abduct. Okay. Now we're going to get you to rotate your wrist for me. Okay. Extend your wrist. Extend your wrist. Flex your wrist. Hyperextend your wrist. Extend your fingers. Flex your fingers. Hyperextend fingers. Flex your fingers. Okay? All right. Now, we're going to do cerebral coordination. I need you to take your hands and flip your hands real fast across your legs like that. Okay? Good. Now, I need you to do each one of your fingers like this real fast. Okay? Then do each one of your fingers to your nose like that real fast. Okay? Let me get you to close your eyes for me. Is this sharp or dull? A little sharp? That's right. Okay, keep your eyes closed. I'm going to put something in your hand. Tell me what it is. Open your right hand. Stereognosis. We're checking for stereognosis. A corn, okay. I'm going to put something in your left hand. Good. Okay. Now, I'm going to draw something in your hand, checking for graphisthesis. In your right hand. Good. Let's go to your left hand. Look in. It could be an L or a 1. Okay, good. Okay. Now we're going to you can open your eyes up now. Let me know when this vibration stop. Checking for ulnar deviation. Malleosa deviation. Checking for that. Let me know when to stop. Okay. Now we're gonna check you for your DTR's reflex, okay? We're gonna start with the brachioradialis. Hold y'all, let me have it right here. Good. Okay, do the other arm. Okay, good response. Okay, we're gonna do the bicep. Good. Good. Now, we're gonna do tricep. Good. Okay. Now we're gonna do the patella. Good. Okay. We're gonna do the Achilles. Can I get your shoes taken off? Then we're gonna do the Babinski. Okay, DTIs before. Now I need you to let me check your hips, your knee, and your ankle and your toes. Keep your shoes off for me. Any discomfort here? Any discomfort in your knees? What about your toes? Okay. Then I'm going to palpate the dorsal pus, the popliteal pus, dorsal pus again, popliteal pus, okay? And now what I need you to do, I'm gonna check your capillary refill in your feet. They come back less than 3 seconds in the nail bed, okay? Then, let me get you to flex your feet, flex it down, okay? Plantar flex, let me get you to flex it up. Dorsal flex is intact, okay? Now, let me get you to flex your knee. Both of them, do them for me, okay? All right, now, let me get you to close your eyes for me. I'm gonna run something across your leg, let me know if it's sharp or what. Soft it is, okay? Now, let me get you to extend your toes for me. Evert your toe, let your toes go in like this. Follow, copy me, yes, okay. Outwardly, okay, good, all right. Now, let me get you to stand up. Let me get you to bend over. Checking your spine for curvature. Her spine is curved with no deviations noted. Let me get you to close your eyes and extend your arms side to side. Any problem? Okay, let me get you to turn around and walk normal to me this way. Walk with me. Okay, turn around and walk that way with your feet. Look at my feet like this. Heel to toe. Okay, stand in one place and hop on one leg. Do the other. It's the end of my session. Thank you.